Benita was my big sister, 9 years older. She was like a second mother and not only helped bring me up, but exposed me to so much of the world. Right from an early age, Benita believed in social justice and acted on it. For example, she was very active, campaigning and working against apartheid and joining protests and petitioning government. She was also actively involved in the anti-discrimination activities of the time in our country and around the world. And she always had a deep passion to help right the wrongs of colonialism. In Benita's life and her work, she was known to be gentle and kind, with a strong sense and commitment to what was right and what was wrong, and making sure she turned things around in the world. She was known for her diplomatic skills, and she probably could have achieved peace in the Middle East if she was able to. Dedication and loyalty were two qualities of hers to the people she cared about and worked with, and the causes she was committed to. Her CPHA work brought her great pride and delight. She viewed the CPHA members as her confreres and was thrilled to have the honor to be president. On behalf of our family, thank you for honoring Benita. She would be thrilled that the people she cared so much for are here returning the love. Thank you.
When I think of Benita, I mostly just think of her smile, and her smile makes me smile. Benita's smile was gentle as her demeanor was, but also there was a spark of strength and challenging status quo that was essentially Benita, that she was a gentle, kind, quiet listener, but with a strength and a resolve to make change and to make a difference. And somehow I feel like that all comes together in her smile. So when I think of Benita, I think of her smile in her kindness and her respect and her dignity for everyone, but also with a spark of ambition to make a difference.
I would like, her to be remembered based on not only her work to advance population health, but just the respect and the calmness and honesty and the intention that she brought to the public health and nursing conversations. And she was really a nursing leader who I think changed the trajectory of nursing through over decades of advancing concepts of population health and health equity and social justice and all of these concepts which mean different things to different people. And like I said, it hasn't always been an easy road, but she definitely is a role model that will continue to hopefully move forward these concepts and this work across Canada.
She just was always there. It was steady. I mean, she was at CPHA, the conference, always. You would find Benita. You'd find her at the Community Health Nurses of Canada conference. So you'd find her at Manitoba Public Health Association. You'd find her at, when we started the Association of Registered Nurses, ground up here, Benita showed up. So Benita, in her very quiet, kind of unassuming way, was there and steady. So that kind of gracious, graceful, quiet, yet really strong presence in so many places that are important to be. Even community meetings, that when I was within the Winnipeg Regional Health Authority, there would be Benita from the college, from the Faculty of Nursing in those community meetings. So she had that amazing sense. And my memory would be that she was so present and she just showed up in such a good way everywhere. And so I still feel her presence today.
I remember her love of the ukulele, and the joy that she would get from making music, and we shared that joy of the sort of personal space for making music, and that sometimes you'll sit there and be making music, and then you work out a problem that you didn't even know that the other part of your brain was working on. And as I think once I even bought her a ukulele stand to hang that on her wall where she does her work, so she can kind of, she's stuck on something, just step away into that musical space. And it makes me smile because the ukulele is soft and uplifting. It plays well with others, and in so many ways is sort of the musical embodiment or the instrumental embodiment of Benita. And by contrast, my primary instrument is the accordion, which is kind of loud and squeaky and unapologetically out of tune, and maybe doesn't naturally play with others, has to work a little harder for that. So we used to joke about our instruments being our sort of personality embodiments, and we joked about making a weird album someday, which we never did, but it would have been something.
I think of Benita as a fierce advocate for social justice, as, you know, her intentionality and being quietly strategic. So for me, health equity is about closing health gaps. It is about being intentional, about understanding where health gaps occur, and remediating them, doing something different to improve the outcomes. And I think that that's part of the conversation with Benita, has been so much of that intentionality of what she brings forward, what she had brought forward, around thinking through, you know, who was at the table, who wasn't, why, how could we change that? How could we be more strategic? How could we insert and bring someone into the table? What are their ways of thinking about things, and how could we engage them to think a little bit differently? And those relationships that were required to change big systems.
All of us who knew Benita are so saddened by her passing, a loss so unexpected and untimely. And yet, her passing has brought us together to celebrate her contribution to public health, and in particular, her dedication to population health in her advocacy role for health equity and social justice. The sadness of her passing has made us even more grateful for her public health contributions to teaching, research, and community service. In her public health and nursing career, she advocated for the marginalized and disadvantaged in society through her many publications, research, and policy work. The rich legacy of advocacy that she leaves behind will forever be entrenched in the work lives of the many nurses she taught, both in the undergraduate and graduate programs at the University of Manitoba. Dr. Benita Cohen, you are truly missed on so many levels, and as evidenced by the memory shared today, most assuredly not forgotten. Thank you.
I loved that about her, that she was such an important member of the board, and giving of herself, but not expecting anything back, and just a real strong contributor, and a very easy person to like and want to know more. So I'm very sorry that she's left us way too early, because she still had so much to give and teach us.